So the case we are discussing today is on influenza. Karen is a 52-year-old woman. She has doubts about getting the influenza vaccine because she once got a horrible sinus infection and the stomach flu after getting the vaccine the year before. She feels it didn't prevent her from becoming sick. She received information from her neighbor about taking antibiotics that were not prescribed for her and were left over from her previous surgery. She claims this made her feel better when she got the flu. She has heard about the antiviral drug Tamiflu that she could just get from her doctor to treat the influenza if she does come down with it. What also concerns Karen is that she has seen recent reports on television that influenza vaccines were made in chicken eggs and that they contain high levels of mercury and other toxic chemicals and antibiotics. People have been saying on the internet that these additives and chemicals have been linked to causing Alzheimer's disease, autism, cancer, and antibiotic resistance. She has also heard that influenza vaccines weaken the immune system, particularly in people who have a weakened immune system to begin with. She has had Crohn's disease for 10 years and is on immunosuppressants, Humira injections. Furthermore, she wonders if she would be better off taking complementary or alternative therapies that would strengthen her immune system instead of any medications or vaccines. Today we're gathered here with a panel of experts. I'm Erin Fineberg and I'm an expert in pharmacology.
I'm Mackenzie, and I'm also an expert in pharmacology.
I'm Annika, Heighway, and I'm a pathophysiologist.
I'm Katy, and I'm an expert in pathophysiology.
And I'm Clower, and I'm an expert in natural and alternative therapies.
So we're going to discuss this particular case, and we plan on coming to a conclusion at the end to determine what course of action we would recommend for our client Karen.
Influenza is a viral infection that is commonly called the flu. It attacks your respiratory system, including your nose, throat, and lungs.
There are two ways the influenza viruses can be transmitted: contact transmission or indirect contact transmission. Indirect contact transmission of the virus occurs by touching a contaminated object or surface and then touching your own eyes, nose, or mouth before washing your hands. Your eyes, nose, or mouth will act as a portal of entry after contact with the virus on your hands. The influenza viruses are also spread by the cough or sneeze of an infected person that releases small, virus-containing droplets into the air. These droplets can be breathed in and infect the respiratory tract of the people around them. This droplet transmission of the flu is known as contact transmission. Once the influenza virus has been contracted, it replicates in the epithelial cells throughout the respiratory tree. Non-fatal influenza viral infections predominantly involve the upper respiratory tract and trachea, while fatal cases of influenza usually show evidence of pneumonia, an infection in one or both lungs. Within the epithelial cells, this negative-stranded RNA virus replicates within the nucleus of the host cell. It inhibits the synthesis of cellular proteins, evades the innate antiviral response, and facilitates the production of viral RNAs and proteins.
In total, there are 3 different types of influenza viruses. There is type A, type B, and type C. Influenza type A and B cause seasonal epidemics. These seasonal epidemics occur every winter in North America. Type A influenza is divided into subtypes based on 2 proteins on the surface of the virus, hemagglutinin and neuraminidase. Hemagglutinin has 18 different subtypes, and there are 11 different subtypes of neuraminidase. The subtypes of influenza type A that circulate around the most often are H1N1 and H3N2. Subtypes of influenza A can evolve many different mechanisms to adapt its function of host processes and suppress host defenses. Both type A and type B are always changing. However, type A mutates faster than type B, which creates new strains each flu season. Influenza type B is not divided into subtypes, but instead are broken down into 2 lineages. The 2 lineages are B. victoria and B. yamagata. Influenza type B is only found in humans and cannot cause pandemics, unlike type A. Influenza type C is not as common and is detected less frequently. It causes mild infections, therefore it does not present public health importance. Strains of the influenza virus mutate over time and replace previous strains. As the influenza virus spreads, it goes through genetic mutation. When the amount of changes adds up, defenses the body previously had are no longer able to recognize the virus, which is known as antigenic drift. One theory believes that antigenic drift occurs when a human influenza virus and an avian virus both infect a species that is permissive to both. The strands from both the viruses mix and produce a hybrid virus. This new hybrid virus contains all the genetic material of the original virus that infected humans, but it contains a new hemagglutinin which contains strands from the avian virus. This virus will become less susceptible to prior immunity. Antigenic drift is the reason why the flu vaccine needs to be updated each year. Scientists must observe and survey the differences so they can match the new viruses and alter what is being administered in a flu shot each year.
A well-known symptom of influenza is a fever. The increase in body temperature caused by a fever leads to many beneficial reactions at the cellular level. A fever causes the body to have a faster neutrophil migration. This is beneficial as neutrophils are the first line of defense in response to invading influenza virus antigens. The fever also causes the activation, proliferation, and increased movement of lymphocytes. Lymphocytes are needed to recognize the antigens of the virus, produce antibodies, and destroy the virus cells that could cause damage. Fever causes the body to produce cytokines. Cytokines are cell signaling molecules that aid cell-to-cell communication and immune responses and stimulate the movement of cells towards the site of inflammation and infection. Another symptom of influenza is a dry, non-producing cough. A cough is a reflex action to clear airways of mucus and irritants. The dry cough related to influenza is tickly and doesn't produce any phlegm. The cough reflex may be agitated through the inflammatory mediators from the nasal mucosa on the airways or as a reflex sensitization of airway sensory nerves. The symptom of a sore throat is caused by the inflammation of the passage from the mouth to the pharynx or of the inflammation of the pharynx itself causing pain. This inflammation is caused by the body's attempt to fight off the influenza virus. Myositis is defined as inflammation of a muscle, especially a voluntary muscle, characterized by pain, tenderness, swelling, and/or weakness. Influenza causes a type of myositis called benign acute myositis, which is characterized by acute difficulty in walking as a result of severe calf pain, which is caused by the elevation in muscle enzyme called creatine kinase. It is unclear why creatine kinase levels rise in relation to the influenza virus. For patients with weakened immune systems from Crohn's disease, like Karen, a possible symptom of contracting the influenza virus is a flare-up of the Crohn's symptoms. The mucosal inflammation that occurs as the result of the influenza virus is the cause of the symptom of nasal congestion. The GI symptoms, such as nausea, diarrhea, and vomiting associated with influenza are explained by the influenza virus spreading into the GI tract after a primary respiratory infection. The route of dissemination is currently unknown for the influenza virus.
Influenza is typically clinically diagnosed. Respiratory samples are collected and laboratory diagnostic tests are applied to confirm the diagnosis. It is essential to have the proper collection, storage, and transportation of the specimens to detect the virus. The confirmation of infection is discovered by using direct antigen detection, virus isolation, or detection of influenza-specific RNA by reverse transcriptase polymerase chain reaction. When it comes to white blood cell count, the range is typically between 4,000 and 11,000 cells per liter of blood. If the white blood cell count exceeds 11,000, it is most often due to an infection. A white blood cell differential test will determine whether the infection is bacterial or viral. The differential test works by showing if the cells are in proper proportion to one another. If there is an increase in one type of white blood cell, it may alter the amount of the remaining types. Lymphocytes are the white blood cell that increase in cases of viral infections, which can lead to a decrease in neutrophils.
To properly diagnose a patient with influenza, obtaining a viral culture is the most traditional method and is considered to be one of the gold standards for the diagnosis of viral infections. A viral culture involves inoculation of permissive cell lines or embryonated eggs with infectious samples. Then propagation for 7 to 10 days to monitor the development of the cytopathic effect. Then finally, a confirmation of influenza virus infection by specific antibody staining, hematabsorption using erythrocytes, or immunofluorescent microscopy. There are a number of flu tests available to detect influenza viruses in respiratory specimens. The most common test is called a rapid influenza diagnostic test, which can provide rapid results in 10 to 15 minutes. Rapid influenza diagnostic tests work by detecting the parts of the virus that stimulate an immune response. Rapid influenza diagnostic tests offer a faster turnaround time for results, but test performance, meaning sensitivity and specificity, varies widely. Nucleic acid amplification testing can offer a viable alternative. Nucleic acid amplification tests are used to identify small amounts of DNA or RNA in test samples. They are used to identify bacteria, viruses, and other pathogens when the material of interest is present in very small amounts, like an oral or nasal swab for influenza. The results of a retrospective study compared the test performance of rapid influenza diagnostic tests with nucleic acid amplification testing. These findings suggest that rapid influenza diagnostic tests have an unacceptably low sensitivity for both influenza A and influenza B, despite their high specificity. In previous years, rapid influenza diagnostic tests have had a faster turnaround time, making it the more desirable test choice. This fact has been challenged by newer nucleic acid amplification testing technology that provides results in turnaround time comparable to rapid influenza diagnostic tests, but with superior test performance.
The short-term risks of influenza that people experience include fever, dry cough, headache, joint and muscle pain, severe malaise, runny nose, and a sore throat. These symptoms usually last up to 2 weeks. The risks of influenza can vary between mild, severe, and potentially death. Individuals with chronic medical conditions are at a higher risk for influenza complications. Those that are pregnant or immunocompromised are also at a high risk for influenza as well. Karen is at high risk for complications if she contracts influenza, as she is immunocompromised due to her Crohn's disease for 10 years now and is on immunosuppressants. Influenza can have lasting effects on your health. It can lead to an increased risk of heart attack and stroke. The flu can also lead to the chances of contracting a secondary infection. The influenza virus takes a toll on your immune system, leaving it vulnerable to other infections. It is common to contract an illness such as pneumonia. Around 30 to 40% of hospitalized patients that have been diagnosed with influenza will contract acute pneumonia. Those that are less than 5 years old or greater than 65 years old are also more likely to be diagnosed with acute pneumonia.
For the most part, flu vaccines are created through an egg-based manufacturing process. Egg-based vaccine manufacturing is used to make both inactivated vaccines, known as a flu shot, and live attenuated vaccines. Candidate vaccine viruses, or CVVs, are given to private sector manufacturers by laboratory partners within the WHO Global Influenza Surveillance and Response System to be grown in eggs, following FDA regulations. CVVs are injected into fertilized hens' eggs and incubated for several days to allow the viruses to be replicated. The fluid that contains the virus is then withdrawn. These viruses used in the vaccines are then inactivated and the virus antigen is purified while they continue with quality testing, filling, and distribution to create an inactivated vaccine such as the flu shot. In 2016, the FDA approved cell-based production of flu vaccines. Laboratory partners within the WHO Global Influenza Surveillance and Response System use influenza viruses that have been replicated within cells to make candidate vaccine viruses, or CVVs, which will then be provided to private sector manufacturers who will introduce CVVs to cultured mammalian cells. In a few days, once the virus replicates, the fluid in which contains the virus is collected from the cells and the virus antigen is purified. From here, they will continue purification and quality testing until the FDA approves the vaccine. T-cell-based flu vaccine production can be made in either chicken eggs or using the cell-based approach, as the viruses are grown in animal cells. For the 2019-2020 season, all 4 viruses used in the vaccine were cell-derived. Cell-based approach can help to speed up the process of vaccination development, as manufacturers are not waiting for sterilized hen eggs to be produced.
Over 90% of the viruses are grown in fertilized chicken eggs, so it may contain small amounts of egg proteins. There is a small amount of formaldehyde, which is harmless because there is such a small amount, and its role is to inactivate toxins from the virus and bacteria that may contaminate the vaccine during production. In some vaccines, aluminum salts are present to help the body develop a stronger immune response against the virus. Again, there is a very small amount and it is harmless. Gelatin is used in vaccines as a stabilizer. Antibiotics are used to keep bacteria from growing during the production and storage. The antibiotics used are usually gentamicin or neomycin, commonly found in topical medications. These are just a few of the agents, but the main point here is that vaccines do not contain harmful chemicals. They work by inserting a tiny amount of the weakened or killed virus into your bloodstream to stimulate the production of antibodies that will attack and kill foreign substances that are known as antigens. They provide protection by generating T and B cells, some of which are memory B cells that have the ability to remember viruses that they come in contact with previously. In order for the antibodies to destroy the virus, they reproduce and multiply so that they can more effectively and rapidly kill off the invaders. This will benefit you in the long run because if you come in contact with the virus again, your body's immune system will be able to recognize the invaders and again, more rapidly and effectively kill off the virus before signs and symptoms even occur. Because the vaccine contains inactive virus, it is not possible that you can get the flu from the vaccine. That being said, there is an individual degree of effectiveness in a person. It depends on who is vaccinated and how well the vaccine matches the circulating flu strain. Twice a year, experts consult to determine the recommended composition of the vaccine. Year-round, they monitor the antigenic drift of the virus. It is based on the antigenic characteristics of the influenza virus that is circulating at the time. It is then tested thoroughly within the World Health Organization Global Influenza Surveillance and Response System. There are currently 153 institutions in 114 different countries that are involved in this process. Very broadly, there are two types of vaccines available. There is the vaccine in injection form and the vaccine in the nasal spray form. The injection form is made with the inactive virus and is usually the type given to those at the highest risk. So for our client, Karen, she would be receiving this type. The nasal spray is a live form of the virus, which is weakened, but it is more of a risk. And then there is the drug Tamiflu, which is available to treat the symptoms of the flu if caught in time. We will be going into further detail about this later.
With influenza vaccine, the potential benefits of the vaccination, which include preventing disease, hospitalization, and even death, outweigh the risk of the side effects or rare adverse reactions associated with the vaccine. Side effects of the influenza vaccination are often mild and disappear within a few days. These may include soreness, redness, and/or swelling at the site of vaccination, headache, fever, nausea, and muscle aches. Influenza vaccine is mainly known for keeping individuals from getting sick with the flu and preventing flu-associated hospitalization for individuals. However, influenza vaccination has been associated with lower rates of some cardiac events among individuals with heart disease, can reduce worsening and hospitalization for flu-related chronic lung disease, such as in persons with chronic obstructive pulmonary disease, and has been shown in separate studies to be associated with reduced hospitalizations among people with diabetes, according to the CDC. Influenza vaccination helps protect women during and after pregnancy, as well as the more vulnerable populations such as babies, young children, older people, and those with specific chronic health conditions. There have also been studies to show that influenza vaccination reduces the severity of the illness to individuals who receive the vaccination yet still become ill. According to the Davis Drug Guide, oseltamivir, or Tamiflu, is an antiviral drug used as treatment of uncomplicated acute illness due to influenza infection. Its mechanism of action is to inhibit the enzyme neuraminidase, which may alter virus particle aggregation and release. The efficacy of antiviral drugs for the prevention of symptomatic influenza ranges from 60% to 90%, depending on the population and specific type of drug. While they weren't proven to prevent influenza or completely expel the virus from the body, antiviral drugs shorten the duration of the illness by 0.5 to 1.5 days when given within 48 hours of the onset of symptoms. One systematic review stated that the benefits of antiviral drugs, particularly neuraminidase inhibitors, outweigh their risks. In deciding whether to use them, physicians should consider the properties of the currently circulating viruses and the patient's individual risk constellation as directed in clinical treatment recommendations. In my opinion, as oseltamivir, or Tamiflu, is a neuraminidase inhibitor, it is a good consideration for reducing the duration of the influenza virus within the body. However, it is not the best prevention method. Humira is a medicine called a tumor necrosis factor blocker. Humira targets and blocks the TNF-alpha. TNF plays a role in the process that causes inflammation. Because TNF blockers, including Humira, affect the immune system, they can lower the ability to fight infections and may cause other serious side effects. Humira affects the immune system and can lower one's ability to fight off infections such as the seasonal flu. According to the U.S. Centers for Disease Control, the most effective way to prevent flu is getting the annual vaccination. An injectable form given with a syringe does not contain a live form of the virus. You should not take a live vaccine, such as flu mist, while on Humira. As the flu shot is not a live virus, all patients on Humira should consider having this vaccination yearly.
There is no shock that our client is concerned with this. The internet has many sources containing false information about this topic. The original study that was published in the Lancet journal stating that vaccines cause autism was proved to be fraudulent and it was retracted. The physician that published it has had his license taken away from him. After that article was released, it caused an uproar in people being afraid to get vaccinations. So the Centers for Disease Control and Prevention has repeatedly tested this theory since, and there is absolutely no credible evidence that vaccines cause autism. One of the ingredients in vaccines that was led to believe cause autism is thimerosal. In a study, it was removed from vaccines in 1992, and it was shown to have no effect on the prevalence of autism. Antibiotics are used in the treatment of bacterial infections. This type of infection occurs outside of the cell. A viral infection, such as influenza, is a virus that is contagious. It replicates and attacks inside of the host cell and uses the host mechanisms to replicate and so on. For this reason, you cannot use antibiotics to treat or prevent viral infections, such as the influenza. The World Health Organization identified persons with chronic medical conditions as more likely to develop severe health issues and are at high risk for severe influenza. Therefore, it is especially important for this group of people to receive the vaccination. In our client's case, this is important for her to realize because it is a common misconception that if you have a chronic condition or are immunocompromised, that the vaccine is dangerous, but however, this is false.
Vitamin C needs to be taken prophylactically before the influenza virus is in the body to be effective in preventing the pathogenesis of the influenza virus. A high vitamin C diet could be effective in doing this, and supplementation may not be necessary. Vitamin C helps T cell numbers, and it upregulates natural killer cell activity and helps levels of type 1 interferons. Echinacea is effective in reducing the length of flus, but the use of echinacea is contraindicated in patients with autoimmune diseases and patients who take immunosuppressant drugs. Karen should consider not using echinacea extracts because of these contraindications. Echinacea's pathophysiology in treating influenza depends on what part of the plant is being used in the extract. In one study, it was effective against a long list of varieties of influenza and worked by preventing the virus's attachment, hemagglutination, and therefore entry into the cell. In another study, a polysaccharide extract was used, and it worked by altering levels of Kc, IL-10, and IFNG, which are cytokines. This altered the symptoms of influenza. Lastly, zinc has been proven effective in reducing the length of symptoms of colds, but there is no literature to support its use in the treatment or prevention of influenza. Since zinc supplements would be of no benefit to her, she should consider avoiding them as well. Other alternative or natural therapies seem to be mainly based on treating influenza symptomatically, such as using salt water or honey for sore throat, or ginger for nausea or indigestion. If she were to be infected with influenza, she could use some of these traditional preparations to help relieve her most annoying symptoms.
After reviewing all of the evidence and the aspects of the case, all of the experts have come to a conclusion on the recommended plan of action.
From a pathophysiological point of view, patients like Karen who have a weakened immune system have a greater risk of more severe complications if she contracts the influenza virus. Karen has had Crohn's disease for 10 years now, which puts her at risk for a flare-up of her Crohn's symptoms.
We would recommend for her to get the influenza vaccine yearly to prevent her potential of contracting the influenza virus.
From a pharmacological point of view, we highly recommend that Karen does receive the vaccine. Evidence suggests it is the best preventative option for her. It is proven to be 100% safe and highly recommended for her to receive it, even though she is immunocompromised. There is no evidence that led us to believe she would be in any harm with receiving the injection form of the vaccine. Tamiflu could still be an option for her. She would just have to take it within the first 48 hours of symptoms, and its only action is to relieve symptoms and shorten the duration by 0.5 to 1.5 days. Tamiflu may lessen the duration of the flu and reduce other symptoms, yet increase her nausea and vomiting. Tamiflu is not a preventative drug.
We would tell Karen that there is no credible evidence that supports autism being linked with vaccinations. To conclude, we also wanted to inform her on how antibiotics are not recommended or an effective drug against influenza because antibiotics are used for a different type of infection. We would help her understand that taking antibiotics that are not prescribed to you or are expired can lead to antibiotic resistance, meaning that the antibiotics would lose their effectiveness.
From a naturopathic point of view, I recommend that she increases the amount of vitamin C in her diet, and if that proves to be difficult, oral supplements can be used. I do not recommend that she use echinacea because of the contraindications, and also do not recommend her to use zinc for influenza because it will be of no benefit to her. These natural therapies in general may help her symptoms, but she should not rely on these as their exclusive defense against influenza infection, and she should still receive the influenza vaccine, especially considering her immunocompromised status.